Welcome back guys, my name is Doc for Session. This is part 2 of our oral health basics in dogs. And today, last week, we discussed yung oral health basics, no? And what to expect when you go and visit a veterinarian for dental prophylaxis and all that. This week, we are going to talk about the 10 common dental-related problems every dog owner should look for in your pets. But before we proceed, please hit like, subscribe, and the bell button so that you get upgraded for whenever we post new videos in our YouTube channel. We are on Facebook, Doctor's Animal Wellness Center, and we are on Instagram, and we are on TikTok as well. So do follow us there. Minsan, mas madami pa yata akong post sa TikTok eh. So, yung mga maliit ang attention span, you can enjoy our videos there as well. On with our topic for today, the 10 most common dental-related problems every dog owner should look out for. Number 1, retained puppy teeth. This can happen in any puppy. Nandito yan usually sa canines, but it's more common in small breeds than large breeds. So always check to make sure that the pup's teeth are coming in and falling out properly. Yung retained puppy teeth can cause severe crowding and allow easy access for bacteria to infect the roots of the adult teeth. Number 2 is oral nasal fistulas. No? So these are very common and in certain breeds like the Dachshunds. No? Basically what happens is that the canine tooth becomes infected. And so yung infect yung canines usually, and the roots are so long that they lie right next to the nasal passages. Dito yan, so ganyan. So that when the canine tooth root becomes infected, it eats away the bone and forms an abscess into the nasal passages. Pag nangyayari yan, this is where yung blood and pus from the nose could indicate a dental issue. Number 3 is bifurcation exposure. So as the bacteria infect the mouth, they eat away the ligaments and bone that hold the tooth. Kasi may bifurcation yan ganyan eh. Kapag kinakain nila yung gum line dito, makikita mo yung bifurcation. So if a tooth stores, the bacteria can actually eat a hole between the roots, causing a pocket of infection there. Number 4 is gingival hyperplasia. Nagiging magilagid ang iyong alaga. This condition is very common in boxers. Basically, it is where you have an abnormal gum overgrowth and it will look like tons of reddish masses in the mouth. However, the catch is gingival hyperplasia can look very similar to a cancerous mass. If you ever see any abnormal discoloration or growths in your pup's mouth, make sure to let your veterinarian know. Number 5, tooth root abscess. Tooth root abscesses can form in a variety of ways. No? So if your pup chews on something like a stick that punctures into the skin near the root, it can give a small road for bacteria to take hold on to. And though the gums and the surfaces may heal, the bacteria may still be present in hordes at the roots. Number 6, improper bite. This is another condition that is fairly common in smaller breed dogs. However, pwede mo rin siya makita sa mga large breeds. The classic underbite or overbite, underbite or overbite. Bite abnormalities kasi can lead to misalignment or crowding of the teeth, so making them more likely to accumulate plaque or tartar. Number 7 is missing teeth or unerupted teeth. No? So this condition is more common in small breeds usually, like yung mga bichons. Yan, very common yan. It can be seen in any dog naman, but mga bichon, pinaka-common. Especially if you adopt an older pup that has missing teeth. Those teeth could be hidden under the gum line or the top of the tooth or the crown. No? Could have been fractured due to trauma or poor tooth health. And the roots could still be present. So nandun pa rin sa gum line yung roots. So these pieces of teeth can cause infection in the future and should be removed. Number 8, enamel defects. There are many different types of enamel defects that can be found in dogs. For puppies that have poor nutrition or that are very sick, they can get severe enamel defects in their adult teeth because yung adult teeth enamel is formed in puppyhood, diba? Also, certain medications such as doxycycline, if given too often, can cause enamel defects in puppies. fractured teeth. A tooth can fracture. Pwede yung mabali in both a variety, in so many ways, no? Due to a variety of reasons. Usually, yung mga masyadong matigas na chew toys, weak enamel can lead to teeth that are more easily fractured. You can have enamel fractures where basically the tip of or a piece of the tooth is missing. Crown fractures where the entire top of the tooth is missing. Or cracks in the tooth that look like canyons. Tooth wear. This is very common in dogs that love to chew, especially yung mga tennis balls. Kaya don't make them play tennis balls. Never ever let your pup chew one. The green fuzzy fibers actually work like sandpaper to teeth and slowly wear away the enamel, dentin, and eventually expose the roots, which can cause the tooth to become infected and either need a root canal or need to be removed. Extremely common in dogs, cavities. Very common in humans, pero wala sa dogs. Though we speculate that dogs are less likely to have cavities than people due to both eating a lower carbohydrate diet and having a more basic or alkaline salivary pH than humans. The truth is, we're not sure what causes the phenomenon, but what we do know is that the cavities or caries do happen in dogs, and it usually happen in the back molars. And if a dog has one cavity, they will be more prone to have more in the future, suggesting a genetic link. There you have it. I hope you find this general overview of dental health for dogs helpful, and I hope it inspires you to be more proactive about your own dog's dental health. Remember, as a pet parent, you are your pup's best advocate, and being on top of their oral health can greatly influence their overall health throughout their lives. If you have concerns about your dog's dental health, please visit any of our Dog First Animal Wellness Centers, or you may call these numbers. Or you may visit www.dogfirst.com. This has been your vet, Dr. Sresho. See you again soon.